Good morning, everyone. Welcome to the Information Day of the European Partnership for Personalized Medicine Research Innovation Technology Call 2026. Welcome to our speakers for today, and especially welcome to all the participants joining to get more information about the call that was launched on the 1st of October. I don't want to say too much. My name is Monika Frenzel. I'm working at the French National Research Agency. I'm your moderator for today, and I would like to hand over directly to Wolfgang Ballensiefen from DLR, the coordinator of the European Partnership for Personalized Medicine. And maybe before we start, if you have questions, you should have the possibility by the chat to address them directly to Mylène Vaillancourt. So please do so. We will take your questions during the course of the webinar. Okay, Wolfgang, please.
Okay, so thank you very much. A warm welcome also from my side. We have already an impressive almost 200 participants, which is very good. So my duty is not taking care of the info day and specific the Research and Innovation Technology Call, the first one from the European Partnership for Personalized Medicine, but to give you some idea what the partnership is like, what are the aims, and at the end a small slide what we are all offering beside this call you're now getting information about. So first of all, I think it's important for us, and also in the light of the call, the vision of the European Partnership for Personalized Medicine is to improve health outcomes within sustainable healthcare systems through research, development, innovation, and implementation of personalized medicine approaches for the benefit of patients, citizens, and society. So that's the overall aim. Just something from the background. There has been a Strategic Research and Innovation Agenda, short SRIA, published by PerMed and developed together with the International Consortium for Personalized Medicine, PerMed. This is actually the blueprint of PerMed activities. There's a lot of very interesting things in there, and PerMed and other programs and initiatives try to put these things in this document into action. So the Research and Innovation Technology Call is one of these actions. There will be updates from this RIA. The first one is in 2027. Background, at the moment we have 61 partners from 28 countries, and we are proud of having 11 regions, partners of PerMed. The total budget is approximately 375 million. There's 275 million from the partners, and most of the partners from PerMed are actually funders or ministries, so they put in cash into the different calls and activities. Over 85% of this budget will be used to support third parties, I mean from the 375 million actually. And there's a maximum of approximately 100 million EU budget. But as the system of co-funded European partnerships, we still have to earn the full amount. And that's depending on especially the two types of co-funded calls we have, which are the JTCs, the Joint Transnational Calls, and this one, which you get more information in a minute. There's a couple of good information sources. One is the webpage, and the other one is the LinkedIn. And you always can get in contact with PerMed directly via the mail, which is also in the middle. Okay, so here is just an overview of the 5 work packages so that you get an understanding how we are organized. Work package 1 is mainly coordination and management. That's led by DLR from Germany. Then we have work package 2. This is all related to PM research and funding. That's ANR from France. Then we have also work package 3, which is led by London government in Belgium, dedicated to PM innovations. And you see already that work package 2 and 3 are responsible for this call. You get more information today. Then we also have a work package dedicated for PM implementation, which is led by IACS in Spain, in Aragon, and a cross-cutting work package 5, which is led by TLS from Tuscany in Italy. And you see we have 3 regional partners leading a very important work package. And the other thing I would like to point out very shortly, you see the logo on the upper right corner. You see yellow, green, and blue, and that's actually the thing that this logo is kind of in line with the ideas we have, that we want to support research and funding for personalized medicine. That's the work package 2, and that's the blue. The innovation steps for personalized medicine approaches, which is mainly for located in work package 3, and even most, not least important, is the support of the personalized medicine approach implementation. So, okay. And I will already finish with this really crowded slide, but I will guide you through. In line with the color code, we have preclinical research, we have clinical research being supported, we have technology being supported, we have innovation steps supported, we have implementation of personalized medicine supported, and we have a special focus on patient-citizen engagement. And all that is to support PM development, innovation, and implementation. So that's the thing. So if we start from the upper right corner, it's just for advertising and putting some appetite on more of the activities happening within EP PerMed. So in yellow marked is actually the call RITC 2026. You'll get more information in a minute. That's the first of this kind. We are already preparing at the moment the 3rd call, and I think yesterday has been a pre-announcement for the joint transnational call 2026. Have a look if you're interested. We have also a networking support call, which is just closed. We have matchmaking events upcoming and ongoing. We have trainings, we have video awards, and we have usually a call advisory board for each of the calls we are preparing and performing. Then in the innovation system, I would say there's also a big part of this call. But we have also so-called fast track calls. One is already, the projects are running. The second one is in preparation. We have a venture creator ongoing. We have round tables. We have also here matchmaking events, schools. A hackathon is planned for next year in spring. And also we are planning to have personalized medicine awards in this area and best practice examples. And we have an innovation advisory board. And then if we continue on the lower left part, implementation is supported by a first survey call, which is hopefully coming this year. Also schools, there's the first one in this setting by beginning of next month in Zaragoza. Then the twinning call is already announced, very interesting tool, which might be also of interest for you. We have in situ visits. There's the next one coming up in Brno in Czech Republic. We have also here best practice examples, and we have an implementation advisory board. Last but not least, we have the patient-citizen engagement supported by all of the co-funded calls. There's just an education call closed. We have a first podcast series already published. There will be a second one, which is in preparation. And we have also a citizen engagement strategy and a people engagement board, which is supporting us in lots of patient-citizen engagement activities. At the moment, we do not especially focus on technologies related to personalized medicine, but the calls and also best practice examples are also kind of feeding into this. But there will be maybe coming more when it comes to the next years of EP PerMed. And as you saw maybe in one of the first slides, our lifetime will be definitely until 2033. So there's still some time ahead. So finally, I would like to thank you for joining, for your interest in the call. If you have questions, again, have a look at the webpage. There's also a database on consortia being funded by EP PerMed, but also by ERA PerMed. There's lots of further information on the partners, the backgrounds, the calls. There's a newsletter you can register to. And if you have direct questions in general for EP-PerMed, you can use the eppermed@dlr.de mail address, and we really try to be as quick as possible in giving you good answers. So that's it from my side. I think it's crucial, and you will have lots of questions when it comes to the call. So I would hand over to Monica again. But if you have questions for EP-PerMed in general, you're also welcome to write them in the chat, and I will try, or we will try, because everybody is aware of most of the things, to answer them. So thank you very much. Good luck. Join the call. And if you do not succeed this time, you might succeed in the next time or in one of the other activities I just presented you very shortly. So thank you very much.
Thanks a lot, Wolfgang, for the presentation of EP-PerMed and also for opening the information day. Yeah, please try, if you have a question, to send it directly to Mylène Vaillancourt via the direct chat. And I think then we would like to come to the main point of today's, well, the focus of today's information day. It is the presentation of the new call that was launched on the 1st of October. It is the Research, Innovation and Technology Call 2026, Test and Demonstration for Multimodal Data Approaches for Personalized Medicine. As you might know, these joint calls are centrally supported by one joint call secretariat, and you have the occasion to meet today the two persons behind the call secretariat. On my right side is Mirik Mashouri, and you can see also online Mylène Vaillancourt, and if you have questions directly, send them to Mylène. And after this meeting, of course, feel free to contact both either by mail, preferentially by mail, but sometimes a fast phone call could also solve questions you may have. So I hand over to Mirik to present to you the Research, Innovation, Technology Call 2026.
Yes, thank you, Monica. So as Monica said, I'm Mirik Mashouri, and I am part of the call secretariat of this call, of this Research, Innovation and Technology call, that is on test and demonstration of multimodal data approaches for personalized medicine. In this call, there are 19 funding organizations that covers 16 countries that you can see on the map and also in the call text, and 5 regions in Belgium, Portugal, and Spain. The overall commitment from the funders for this call is 14.8 million euros. And here you have our information to contact either Mylène or myself at this email address, but you will also find it in the EP-PerMed website, where you can find all of the information regarding the call and even more if you're interested in the partnership. On the Research, Innovation and Technology Call webpage, you will find the submission tool with this link, the information regarding the call secretariat, which are Mylène and myself, our email address and phone number if you need to, and also the contacts of the different funders involved in this call. You will find the call documents, which includes the call text, the guideline for applicants, and the pre-proposal form. And at the full proposal stage, maybe the full proposal form, you will have a short summary of the call, of the eligibility criteria that I will develop today, and all are present in the call text, and also a link to the partnering tool and the online matchmaking that our colleague Casper from Vinova present a bit more later. So the rationale and the scope of the call. Multimorbidity is a major global concern that affects between 20 and 40% of middle-aged adults and even up to 80% of other adults. It presents several challenges to manage chronic disease and multimorbidity, especially regarding treatment and during treatment interaction that can have harmful effect in many others. And that's why we need a personalized medicine approach and a data-driven approach with healthcare data, test, and learning environment to support clinical decision-making and improve patient care and outcome, and to adopt a sustainable, innovative care model. And also test-bed and learning environments can bring innovation closer to the healthcare system and implementation to ensure that solutions are technically sound, but can also be useful, meaningful, and sustainable in a real world. The aim of this call is then to fund projects in human health that will focus on multimodal data usage for personalized medicine approach, and aiming to provide more efficient and personalized management of patients with multimorbidity, having at least 2 chronic diseases that requires management. It is also to bring closer enterprises with clinical actors, healthcare provider, patients, and researchers, and to test innovative solutions in controlled real-world setting to address a clear need in managing multimorbidity. So the project that you will submit in this call should address one or more of these following aspects that are comorbidity detection, disease progression monitoring, remote patient care, decision support, treatment management, and treatment adherence. It is to note that clinical studies like exploratory proof of concept and early stage clinical studies can be funded in this call, but larger calls are not in the scope of the call. And the core objectives of the course is to advance personalized medicine approach to have a more efficient management of multimorbidity by addressing a clear health need for managing chronic diseases, to develop innovative solution, combination of innovative solution, testing those solutions in a controlled real-world setting, and approaching, integrating, enabling elements. And then, because it focuses on multimodal data, it should have a clearly defined and pressing need in human health to robust use of multimodal health data from multiple sources, and the project should present a clear strategy detailing all about the data collection from various sources, data processing, and data usage, having in mind that the patients in the middle of all of this data collection and use. The funded projects are required to test and develop innovative solutions in control real-world-like settings, environment that can be as well real-world condition like hospital-based environments, outpatient care, but also simulated clinical testing environment and virtual test environments. It is not limited to those 4 examples, but it is to show the scale of the different possibilities. And the applicant should also, you should also include a clear description of how the project aligns with these 6 enabling elements that are organization behavior and values, knowledge integration, technologies, product method and processes, infrastructure utilization, business value model, and policies and regulation. So yes, now I'm gonna explain a bit more the eligibility criteria. For the first stage, like the consortium composition should have at least 3 eligible partners from 3 different countries participating in the call, and a maximum of 7 eligible partners. Patient and citizen representing organizations are not included in these counts, and no more than 3 partners per country and per funding organization can participate, and no more than 2 partners on own funds. This is the general rules, but it also depends on the different funding organizations. Some might not be able to fund 2 partners in one project, but I will give some examples just after. For the organization representing a patient or citizen, they can request funding to PerMed directly or to the national and regional organization. They must be eligible. If they request funding, they must be eligible and follow the general rule of eligibility that are no more than 3 partners can request funding from the same organization. There is also a cooperation with the Maltese funding organization. I will not try to pronounce it because I don't know how to, but through access to partnership scheme, Maltese researcher can participate in the PerMed code as partner on funding. And like that, they may be eligible to up to 300,000 euros per project. They will be registered as partner on funding, but they will have to do the procedure with the Maltese funding organization after to receive this potential funds. And then at the second stage of evaluation, in the full proposal, there will be the possibility to add 1 more partner from an underrepresented funding organization from the first stage of evaluation. So on top of this eligibility criteria, your consortium should present at least 1 enterprise for profit. It can be all size, can be large, small, medium enterprise and industry. It is required to also have a clinical partner. It can be public or private health sector that is represented by research team or clinicians working in a hospital or public health care settings. And also academia, so research team from universities or higher education institution of public or private research institutes, as well as private nonprofit partners that can be foundation, association, or non-governmental organizations. So here is an example of the minimum consortium with three, on the left, three eligible partners from three funding organizations, three different countries, EU member state or associated countries whose funding organizations participate in the call. And on the right, you can see an example with partner on own funds. So to have partner on own funding, you still need this basis of the three partner eligible from countries participating in the call. And then you can add one or two, or you can add a fourth partner on own funds that doesn't have to be from participating country in the call. To note that it is important to check the eligibility criteria of your funding organization because they might change from one organization to another. And everything is present in the Annex 3 of the guidelines for applicants. And you can also get in contact with the representative of your funding organization. And so here an example of a bigger consortium with a maximum of 7 partners. So we can have 7 partners from 7 different countries and 7 different funding organizations. And to note that patient and citizen representing organizations are not included in this call and can be added at the pre or full proposal stage. Even they still have to respect the general eligibility rules. And you can also have here on the bottom another consortia with 7 partners, but here with 3 that are from the same country and requesting funds from the same funding organization, which is the maximum allowed. And same here, some organizations do not allow, who cannot fund 3 partners in the same consortia. So be sure to check the eligibility criteria. So here an example of a consortium that respects all of the criteria. So there are at least 3 eligible and funded partners from 3 EU member states or associated countries that are participating in the call. There is at least 1 partner that is an enterprise, like here and here, and at least 1 that is a clinical partner here and here. There are no more than 3 partners that are requesting funds from the same funding organization. So there is the example here with only 2 from the same funding organization, and no more than 3 partners from the same country. So we can see here for the country 3, 2 partners are asking funds to the funding organization, and 1 is self-funded, which is a maximum limit. And there are maximum 7 partners, not counting the patient organization that is present in this consortium. And no more than 2 partners self-funded. You can find in the call text this eligibility criteria in a table here. with the number of partner of your consortium and the maximum number of partners you can have that are on funding or per country, and with the different conditions. Be sure to look at the different call documents. So you can have the call text Annex 2 or the guidelines for applicant Annex 1, in which we'll find the regional and national contact details. In the call text Annex 3, you have an indicative funding commitment from the funding organization, and you can also find information on what type of partner they can fund or not fund. Some will not fund enterprise, some will not fund academia. It is important to check before going further. In the guidelines for applicants, Annex 2, you will have the guidelines for patient organization or citizen organization. And in the Annex 3 of the same document, you will have all of the eligibility criteria from the different specific eligibility criteria from the different funding organization. So yes, next I will talk about the evaluation criteria and the proposal submission process. So I will not go too much into details into the evaluation criteria because you will find a better description in the call text, but there are three main criteria that are excellence, impact, and quality and efficiency of the implementation. Your project will be scored according to the below scoring system. So for each of these criteria, experts that will evaluate your project will give a note from 0 to 5. And yeah, so some will be made. And regarding the submission process, so it is in two parts. One part is a PDF document to complete, which is a pre-proposal form that you can find on the PerMed website. It will be the same for the full proposal. To present mainly the description of your planned work, your work packages, your budget, and all of the information concerning your work. And then you will also have in parallel the electronic submission tool that will ask more information regarding the individual partners and organization and the financial plan. I will present in the next slides a bit PT outline submission tool, but it is to know that it is quite time consuming to fill in those two documents. So I will recommend, if you haven't already, like if you are interested, to take a look at the Word document to be filled in and to the PT outline platform to intake the amount of information that is requested. So the submission tool looks like this. You will have on the left a column with the different information. You will get again the information from the call secretariat. You will have the deadline to submit your proposal, which is January 12th, 2026, and the different section here to be filled in. So once you logged in, you can click on create a new proposal, and here I did it and I have my own. And you will get in the overview page the general information and description of the code, you will have again a link to the PerMed website where you will be able to download all of the documents necessary. And then you will have to, you can go on the general information where you will fill in your project title, acronym, duration, keywords, and abstracts overall. And the checklist for coordinator to give us a little information if you submitted this project before, was it in PerMed or PerMed before, that you took into consideration all of the information that were given to you. And then for each project coordinator and project partner, you will have all of your information to enter regarding yourself, your organization, department, the funding you are requesting, to which funding organization. And so maybe one or two more information for the coordinator than for the partners. For the partners, you will see that you will enter information for our first partner, and when you click on register or save, then at the top of the page, you will see here a line with the information of the partner. And then you can add other project partner once the first one has been saved. Then you have the project description page, which is here on top, on which you will need to upload the PDF file filled in. That is the pre-proposal form or full proposal form when it will be the time. And you can also download some annexes that I will present just shortly after. And at the end, you have the final check and submission, in which you will see the table with the different, with the coordinator and the different partners, the total funding requesting, and the total cost of the project for itself. And then you can submit, and you should receive an email confirming the submission of your project. So there are 6 annexes that can be asked when you submit your project, either pre-proposal or full proposal. I will focus more on the 4, 5, and 6 because the other are more for the full proposal stage. So the next 4 is the letter of commitment for project partner participating on fund, declaring that it does intend to participate in the project, and on his own fund. The Annex 5 is supporting letter or endorsement letter that can be on your own format from different institution, organization, mainly patient or citizen organization. And then the Annex 6, which is Annex for participation or citizen involvement plan that is mandatory if a patient organization or citizen organization applies for financial support from PerMed. If it requests funds to its own national or regional funding organization, it is not mandatory. And here is a recap of the timeline. So we are here October 28th for the information day. The deadline for the pre-proposal submission is January 12th, 2026. at 2 p.m. Central European Time. And we will communicate the result of the first stage, the pre-proposal stage, and invite you to the full proposal stage around March 19. You will then have the deadline for the full proposal end of April, a rebuttal stage end of June, and we are expecting
Tu es mute? Tu es mute?
Oh, no, sorry, I had a little internet issue. So to conclude on all of this information, everything is present in the document that are on the PerMed Research, Innovation and Technological web page. It is important to read carefully the call text and the central and regional or national eligibility and budgetary criteria before starting a proposal, to be sure that yourself are eligible and your consortium as a whole is also, and that you have all of the formal requirements. If you have any question regarding your eligibility, you can contact us at the call secretariat. But if it's a specific question regarding your own funding organization, you are free to contact the representative of this funding organization. For all of the general questions regarding the call, it is to contact Milen or myself. And yeah, your project should clearly outline the personalized medicine perspective in your proposal.
Yes, I see a comment there from, thank you, Louise. You can hear me and you can see my slide. Good.
Yes, everything is fine.
Good, thanks. Right, so hi, my name is Kasper Ullsten-Wallen. So I work for the Swedish innovation agency called Vinnova. And I also have my colleague Malin Eklund somewhere here in the digital audience. So we've, from Vinnova's end, we are one of the funding partners in PerMed and one of the funding partners in the call. And we've been part of the team developing the call together with ANR and others in PerMed, and we are very happy and excited to see now the call being launched. So from now, ANR is leading the implementation, administration of the call, and from Vinnova's end, we will take care of what we call the Engage and Connect package. So it's an online support package aimed to help you applicants in understanding the underlying concepts and to form consortia. So let's see if I can switch. Right, so as you've heard, the call, it differs a little bit from the typical joint transnational calls that we have in PerMed. So this is a systems supporting innovation call, which may be more challenging, but with the supportive tool we have and owing to the longer opening time we have of the call, we think that this will be fully manageable. So the Engage and Connect package, what is it about? It's composed of a partnering tool, a matchmaking event on November 18th, and a supporting webinar on December 4th. We might add further activities down the line, so you need to keep eyes open on the partnering tool and the platform for more information. And just to mention that, of course, participation is free of charge. Registering to the partnering tool and using it, there are no license costs, and attending the matchmaking event, and the webinar is of course free of charge. And we also want to point out that these are voluntary activities. They're not part of any application process, or you're not evaluated or assessed in any way. So we do believe that this package will help increasing the understanding for the call and the underlying concepts, leading to higher quality proposals, decreasing the risks of delays. And if you get funded, you probably, hopefully, have better chances of a successful project implementation. So just to give you a glimpse of what the partnering tool looks like, we warmly recommend that you go to the website and sign up. Again, it's free of charge. You find the link on the bottom of the page here. It's also on the call website and in the call documents. If you don't find it or you don't manage, just reach out and we will help you. So what the benefits of signing up here? First and foremost, it's for you to find collaborators. I saw questions popping up in the chat. That makes us very happy that you're looking for collaborators. Second, this platform provides you with an entry to the matchmaking event on November 18th. So you need to be registered to the partnering tool to access the matchmaking event. And third, what you can do through the platform also is to apply for pitching. So during this matchmaking event, there's an opportunity for you to pitch your need for collaboration. And I will describe the process in a little while. So at the bottom here, you can see some of the tabs on the website, the partnering tool, and we just wanted here to highlight some places of particular interest for you. Have a look at the participant and organization tabs. So currently you can see 59 participants representing 49 organizations from 17 countries. So it's already a pretty good start for a place to find someone to collaborate with. So go there, find some collaborators. You can save or bookmark contacts. You can send direct messages and start interacting already now. There's also a marketplace where you can post a small pitch to invite for collaborations. You can also read the ones that have been posted. And there is also a dedicated tab for the matchmaking event with a lot of information and a more detailed agenda about the event. In short, make sure again to register to the platform. The event itself takes place 18th of November from 10 to 3:35 Central European Time. And the main activities in this event will be keynotes held by leading experts. So the aim is to inspire, set the stage, but also to widen the understanding of the underlying concepts of the call. So here we have speakers who will talk about chronic diseases, multimorbidity, and innovation in healthcare. And then the pitching sessions, that's the second main activity of the event. Here is where you can get 3 minutes on stage, on the digital stage, followed by a few minutes of Q&A to pitch your need for collaboration. And for this, you need to apply. This application procedure is very basic. It's a forms that you fill in, and it's mostly for us to organize the event in the best way. But you need to apply, and you do so before November 9th. So our keynote speakers for the matchmaking event will be Dr. Jana Tsolaki from Imperial College in London. She's a professor in chronic disease epidemiology, and she's co-leading a biomedical research center on multimorbidity. And from the private sector, we have Dr. Joanne Hackett from IQVIA in the UK, who is head of genomic and precision medicine. She's also an entrepreneur, investor, a strategist, and former CCO of Genomics England. So we think we have a good panel of inspirational speakers here. And then the pitching, I mentioned that you can get 3 minutes, 2 minutes Q&A. The idea is to have a quite basic presentation. So don't hesitate in applying for this and doing this. You basically will present who you are, what you have in terms of a solution or an infrastructure that you have, perhaps access to a test setting, but you also describe what you need in terms of collaboration. So it's to trigger networking and collaboration for the call mainly, but of course for the future as well. And after the sessions, there will be breakout sessions. So you have sort of high-paced short pitches, and after a number of pitches, we will dive deeper into separate sessions where you can continue to interact with those you may be interested in. So again, make sure to apply for the pitching. If you do apply, we will notify you a few days after the deadline, so we will be quick to give you a reply. And if you're invited to pitch, we will send you further instructions on a PowerPoint template. And this is also not something that will require a tremendous amount of time from you. It's meant for really meant to just support you. And afterwards, we will publish the pitch decks. So you're going to have one or maybe two PowerPoint slides each, and they will be published on the partnering platform. It means, of course, you shouldn't include confidential information, but it also means that you can go there afterwards if you would miss the event itself and see who had been pitching. Right, so I think this is my last slide. We also have a supporting webinar planned on December 4th. It's also an online digital event. For this, you do not need to register, but you need to access it through the partnering platform. It's from 10 to 12 Central European time. And again, we will have keynotes, leading experts, and with different topics complementary to those that were described during the matchmaking event. So the final agenda is to be confirmed, but the plan is to have speakers talking about advanced test settings in healthcare and patient engagement. Right, and contact details to the call webpage and the partnering platform, call secretariat. So for any questions, general questions about the call itself, application procedures about the call, you should reach out to the call secretariat. If you have questions about matchmaking and the webinars, you can reach out to me or to my colleague Malin at Vinnova. And for the partnering platform, we have EIT Health as a collaborating partner, and you have Laura Pratt as a dedicated person to answer technical questions there. So time-wise, remember, I warmly recommend you go now and sign up to the platform. November 9th, pitching application deadline, and November 18th is the matchmaking event. And on December 4th is the webinar.